So I'm 37 weeks pregnant. Honestly, almost 38 weeks this upcoming Sunday. And it's Thursday, so I'm almost 38 weeks. 37 weeks. So, man, you never really think you're gonna get to this point. Like, you go through your whole pregnancy and you think, oh, this is gonna literally last forever. And then you get to the end and you're like, that went so fast. It was like a blink of an eye. Anyways, so I didn't do any video for 34 weeks, 35, 36, and now my 37th week. So I'm going to put them all together in this video. My baby is measuring at 5 pounds. I think it was 10 ounces. So there's that. I think most babies are measuring in the 6 pounds right now. They told me that he's lighter than average, which I'm actually very thankful for because my vagina is not very excited for what's about to come. But knowing that he's a little bit smaller, maybe it's giving that little incentive or excitement that it won't be as bad as I think it's going to be. I think since week 36, knowing I only have 1 month left has been kind of giving me these emotions that I haven't had for most of the pregnancy. Towards the end, it's just like a big cluster of fear, excitement, and just the unknown, like that, the questioning of what is life going to be like. And I've been doing that a lot lately, because this is my first kid, so it's like I don't really know how my life is going to change, but all I know is it's going to change drastically. So yeah, I have my notes on my iPhone. So I've gained I have to talk about this because it's quite interesting to me. I've gained about 28 pounds so far. So I mean, in total, I think I'm gonna gain a total of 30 because I still have like 2 weeks left, I mean, if he comes on time. I actually didn't go over too much of what's going on with the baby this week. I think that's one of the things that happens too, is that you stop paying attention to your apps and what's going on. All I know is he's getting bigger, or maybe stronger, but I mean, his growth isn't going to get too much, like, it's not going to increase by much from here. They told me probably not more than a pound from this point. So, just his kicks are getting more intense. I think the space, the uterus sac or whatever, it's like getting smaller, and so I can just feel him jabbing every part of me. He is a kicker. Probably has my strong legs. So I probably gave those to him. Symptoms, must go over these because I think towards the end is when you just really get the intense symptoms. Speaking of symptoms, I have been increasingly thirsty. Really thirsty, like all the time. And I'll drink like 2 of these. I'll try to drink 2 of these, and then once I do, I'm like still thirsty and I wake up with a dry mouth, and I don't know if that's a normal pregnancy symptom. I keep forgetting to ask my doctor, but I hope it is. Some of the big symptoms the past couple weeks, and I think will only get worse until the baby gets here, is about a week or 2 ago, I had the worst backaches ever. I was like incapacitated for about 3 days. I literally felt more comfortable crawling on the floor to go do things than I did standing up. So, there's that. But luckily, I think he shifted in my body, and so whatever he was up against, like he kind of went off of it and my backaches went away. But I do hear they come back during childbirth, so I'm kind of ready for them, but I'm just glad that I have this like moment to breathe where I don't have any backaches right now. Another huge one, especially this week 37, is indigestion. Oh my god, I cannot fit anything. I'll eat like breakfast and then I'll be like, okay, I feel full, I know I'm full, but then lunch comes around, I'm starving. Like, I'm just always starving. I think my appetite has definitely increased this pregnancy. But the indigestion gets so bad. Like, I'm like burping right now just because I ate lunch and it's like, ugh, ugh, like it feels like it's just gonna come up. And so honestly, it's one of the worst things, I think. That feeling of like just indigestion almost all day past breakfast, or probably past lunch. So just, just 2 more weeks of this, that's okay. Hopefully 2 more weeks, not 4. Or maybe earlier if he comes earlier. Another huge symptom is, kind of going back from the first trimester. I was really exhausted first trimester. This final trimester, the third trimester, I'll have like winds of energy, just like randomly. I'll wake up and be like, oh, today's a day that I can get a bunch done. And then another day I'll be like, oh my god, like I just need to lay in bed and just like mush out. So today has been like a wind of energy and I got a lot done, so that's good. Really uncomfortable to sleep. I'm sure that's what all of us are going through right now if you're pregnant at this end of the third trimester. I am able to sleep well, so I'm not going to complain about that, but I do have my days where I just can't sleep, so it does happen. I do have my insomniac nights, but mostly good, so thank you, whoever. Thank you, baby. So sleep is just still uncomfortable. I can't wait to sleep on my belly. Cannot wait to sleep on my belly. You know what? I've been noticing that I've been getting more contractions on certain days. This last Sunday, I actually thought I was going into labor. TMI, but I literally went to the bathroom 5 times. Yes, number 2. And I just felt like it was like my body was pushing out all of the poop. And I kept having contractions and I was timing them and I was like, oh my gosh, if these are right, like I'm gonna go into labor soon. And I was like, it couldn't have been that quick, But after about like an hour or 2 of contractions and stomach discomfort, it kind of subsided and I was able to go to sleep and it was just false labor. But really I got a little taste of what it's gonna be like, and man, is it gonna be uncomfortable. But yeah, belly aches, cramps, firm belly is just been a big thing going on lately. I kind of have bouts of constipation. That was more so a couple weeks ago. Now I'm kind of like every other day I'm using the restroom, or if he shifts or if I don't have enough space in my body for some reason, I feel it, like I'm overly full because the baby's taking up all the space, like I have to go to the bathroom because it's like something needs to go out for me to have some space. I think a lot of gas has also accompanied these last couple weeks. I know the reason for that is probably, because, your belly is just like pushing, there isn't enough space, so I think you're just like expelling air from your organs, from your bowels, so you're farting more. And also, the increased progesterone is increasing the amount of flatulence you have. It's so wonderful. And I still try to hide my farts from people, so I'm walking into rooms, turning on, the fan, trying to just get away from people so people can't hear me. So really no food aversions. My husband made lamb yesterday, And I had a huge aversion to lamb in my first trimester, just meat in general. And I smelled the lamb and it was still pretty like not, I wasn't feeling it. But not as bad as the first, like it wasn't making me gag or anything. Like I couldn't even have him around me because of the smell of the lamb on his shirt. But now it's just kind of like, I'm not going to eat it, but it's not going to make me throw up. Which is weird because I really like lamb. So, and then food cravings, the big ones this week, and for maybe this week especially, has been fruit. I have been eating so much fruit. Grapes, peaches, nectarines, watermelon, what else, like everything, blueberries, pineapple. Oh, pineapple has been a joy. Tip of the day, frozen pineapples. Oh, so good. I just get the Trader Joe's frozen pineapple pack and I just munch on them. They're the best snack. Just trust me, ladies, do it. Let's see. Oh, and smoked salmon. I've been having smoked salmon avocado toast for breakfast most mornings, so there's that. So good. Yeah, smoked salmon with some cream cheese and avocado on top of a gluten-free sourdough bread. Bon appetit. So those are my cravings. So my thoughts for the last couple weeks, I can't really remember much about 34, 35, but it's all the same pretty much for me. It's just a blur. But my thoughts for, you know what? I had to get my GBS done at week 36 last week, and then I went into my doctor's to get my results yesterday, and I do not have GBS. I know it's very common. 1 in 3 women have a GBS positive result, and if you do, you have to get the antibiotics. Once your bladder breaks, they hook you up so that you can get some antibiotics so that the baby does not have any afflictions from your GBS. So I was just really happy because I want to do everything possible to avoid antibiotics. I really don't react well to them. I know that's kind of weird, but it just, my body does not feel good when I take antibiotics. So I'm so happy I'm negative. That was fun. And then you know what, at my 37 weeks yesterday appointment, the nurse practitioner actually checked my dilation, and she said that I was at 1 centimeter, which is a little bit of progress. I feel like I was more because of that labor scare on last Sunday. But no, I'm 1 centimeter and I'm 50% effaced. If you don't know what that means, look it up. It's kind of hard to explain, but it's just the thinning out of your cervix. So I'm at a halfway point of my cervix thinning out. And I know it doesn't really correlate to any sort of like, oh, you're going to go into labor soon type of thing. I think the dilation is more of probably an indicator of if I'm going to go into labor soon or not, but I'm only 1 centimeter, so, but you never know. He could come any day now. And because he can come any day now, I have been going crazy with everything. I've been vacuuming. I feel like I've been cleaning every surface every day just in case he comes. I just want to have all the surfaces clean. I've been organizing. I finished packing my hospital bag, so there's that. And if I have some time and energy and I want to do it, I'll make a video on my hospital bag because I did a lot of research for that too. And I wanted to pack all the things that I would need, my husband would need, and my baby would need. I was telling my friend this morning, it's really weird packing for someone who doesn't exist yet. Or like, you know what I mean, like he exists, he's in my belly, he's alive, but he isn't here yet, like out. So it's just funny packing a bag for a third person. Now that's going to be the story of my life, packing a bag for a third person. Let's see. Other thoughts for this end of my freaking 3rd trimester, 37 weeks. Extra chafing. I am chafing like crazy, guys. I have gained a lot more thigh weight than normal. That's just where I gain weight. So because I've been less active the last couple weeks, I've been noticing I've been chafing a lot. I got some bicycle shorts, and those are nice because they keep my legs and thighs from chafing. Thank you, bicycle shorts. Tip for moms, another one. I also find it hard to move on certain days because my abs are, like, stomach is just so sore. It just feels like it's stretching or just like holding this almost 7-pound being, or almost 6-pound being. So there's that. You may need help from your husband or whoever's near you to get up from a couch or laying down position. I'm kind of stubborn and I like challenge myself and I try to get up without help. It's been going pretty well, but towards the end of the day, it is nice to have some help. You know what? Another thought is the Tdap shot. I don't know how many of you guys got the Tdap shot, but that was something they recommended for me at 36 weeks. Totally didn't even think about it, didn't get the shot. Now I'm at 37 weeks. It's supposed to prevent whooping cough, and I know they get a vaccination when they're at 2 months or so with the Tdap for newborns, but you're supposed to get it at 36 weeks or a little before 36 weeks to prevent them from getting whooping cough. It's like you getting the shot to help their immunity. I didn't get it, but I am extra careful, and I'll be extra careful with him, especially the first couple months. He's not going to be exposed to very many people, especially with the whole coronavirus thing going on. He's not really going to see that many people at all. And then we could decide if we want to get the Tdap shot for him when he's allowed to get it. It's either 2 or 3 months that he can get it, or 6 months. I will have to look that up. But vaccines are such a touchy subject that I honestly, it's whatever you guys want for your kids, you know? That's what's best. Let's see. Oh, I've been looking at pain relief methods. I've been looking them all up, like what are my options. I've learned about a walking epidural. That's pretty interesting. I never knew that existed, but it's just a lower dose of your epidural so that you can kind of walk and move versus no movement at all. I'm still trying not to do the epidural. I'm trying to do natural birth. So I've also been learning natural techniques like breathing, hypnosis. There's the essential oils. There's the diffusers. I'm trying to make a playlist. I'm teaching my husband like different massages he could do for me, him to remind me to breathe. So I've just been watching a lot of natural childbirth videos because I don't want an epidural. And I might make a video about why I don't want an epidural and why I want to do natural childbirth method in another video so that I can watch it when I'm giving birth and remind myself why. So I'll do that in another episode. Oh yeah, I'm also researching the shots that baby gets when they're born. The ones I can remember are the vitamin K shot. That's for blood clotting. I know they have to get the vitamin K shot if you want to circumcise your baby, so that if you want an epidural. If you want to get them circumcised, you have to give them the vitamin K shot. They also get an antibiotic eye ointment in their eyes. And they also get the Hep B shot, and I know all of these are optional and you get to make the decision. So there's that. So those are my thoughts for the past 4 weeks, the past month of my pregnancy. These were the questions that I had for my doctor at my 37 weeks appointment. I asked the nurse practitioner, but she did have answers for me. I asked, does my hospital require that I wear a mask during labor? And her response was that I do not need to wear a mask during labor, and when I'm in the room I don't have to wear a mask. I may have to wear a mask through the hospital. My husband and whoever goes, their birth partner, has to wear a mask. She said that she thinks that they have to wear a mask in the room too, but I mean, wouldn't want my husband to wear a mask for 30 hours in the labor room. So we'll figure that out. And if your husband wants to wear a mask for 30 hours in the labor room, if you're laboring for 30 hours, that is your guys' choice. I was just telling you what my opinion on that was. To each their own, right? So yeah, and then I asked about if they're gonna test me for COVID. Of course, these are coronavirus related questions because that is the times right now. But they do test me, and I know that I have the option to decline it if I do not want to be tested for COVID, because I do not have it. I asked her about not getting an IV, and that is something she told me I have to talk to the nurses about, because I don't want to get an epidural. I don't need antibiotics, so there's no need actually for me to get an IV in my arm, and I know that I've had an IV before and it's just very uncomfortable. So I'd like to just have one less thing to worry about during labor, you know? So, and I hate needles, so that's avoiding IV, avoiding epidural, needles. But I am a nurse, so it's kind of strange. I don't like needles in my body. Excuse me, that was my indigestion. Alright, almost done. Oh, and then I asked about sex during the end of pregnancy, and she told me even if we are dilated, that sex is okay. And I asked what if we hit the head, and apparently it's okay. Like, they are surrounded by their my uterus and the amniotic sac and whatnot, so sex is safe. And I know, like, I knew that, I just had to ask because it's just something that it just feels like it might hurt him for some reason. And then I just asked, this is my last question, I just asked her, like, what do I do when I go into labor? Like, I don't think a lot of people think about this until they go into labor, or they have, like, structured plans and everything, which I kind of did, but I didn't really know the protocol for my doctor. And so when you're in labor, you're supposed to call the hospital to let them know you're gonna come, you know, that, hey, I'm coming, like, keep a bed open for me, like, I'm having this many contractions that are this long for this long. So she told me to call the doctor's office, and if it's after hours, they'll have an after hours number, and if it's not after hours, then we just let them know to let the doctor know that we're going into labor. So yep, that's it, guys. And then one thing I just want to mention to you guys, I learned also the 511, it's called the 511 technique, to remember when you should go to the hospital when you're in labor. It's when you're having contractions every 5 minutes, and they're lasting for at least 1 minute for 1 hour long. Soon I will be having to use the 511 technique. Anyways, guys, thanks for listening, and that's my 34, 36, I can't believe I just skipped 35. This is like baby mom prego brains to the max. 34, 35, 36, and week 37 for me this week. Thanks, guys. Bye. This is my 37-week belly. Can't even see it. Straightforward. So here is a side view. Wow, look at that thing. I am ready to pop, guys. Look at this. Man. You know when you're ready to pop and all baby fat right here, guys.